Okay, we're going to be doing a little bit of a treatment of sternocleidomastoid. So I'm just going to be pointing out a few kind of bony landmarks and some muscle techniques and things that I use for treatment when I'm working on sternocleidomastoid. Easy way to access it, I have cupped her head, kind of turned her head away, contralateral rotation. I'm going to ask her to just start to lift her head up out of my hand. So really easy access is to look for the sternal head, which is right in this area here, but underneath it and slightly posterior to that is the clavicular head that are going up. So one of the things that I'm going to start off with, because I don't have any oil or lotion on my hand at this point, is I want to kind of assess it without a lubricant. So I want to be able to palpate all the way along it and see how much resting tension there is within the muscle. Now with our body today, it's actually quite mobile, which is nice, but on certain people it's going to get extremely tight towards the top, or you won't be able to lift it up at all, or it might feel quite tense or even painful when you're working on those lower attachments. So the first thing I'm going to do is just try to pick it up a little bit and do a little bit of bowing, using my thumb and my finger, using the side of my finger. Again, if she was to lift her head up slightly, you can see I'm trying to get in on that posterior border, and then she's going to relax. I'm going to take my thumb and I'm going to grab the anterior border, and I'm actually just going to create a little bit of a bowing to it. Now, I like to sustain some pressure in here, so I'm not going to keep moving back and forth and back and forth. I'm just going to hold it in this position. But I am going to check to make sure this is comfortable on a pain scale and that there's no kind of a choking sensation or anything that goes along with it. You're good with my pressure at the moment?
Yes.
Okay, perfect. So you wait, you kind of hang on to that a little bit. Again, as I said, it often gets really, really tight up towards the mastoid process and where it's kind of meeting with your suprahyoids. So I'm going to grab that belly and I'm going to do more of a posterior pull on it this time. Just trying to peel it away a little bit. You got to be careful. We are working near a lot of arteries and nerves in this area, so I am trying to do more of a lift and pull than a compressive force that goes down. Similar, I'm going to get her to lift up her neck again. So I'm going to try, you can see me using my finger here. I'm going to pull away, so I might use a finger or two. I'm going to peel this away in the front. I'm just going to sustain some pressure in this area. Now, if that feels like it's a bit compressive on the front of the throat, dare I say more of like a choky sensation, then I might try pushing it more medial. So again, going on that lateral border and trying to peel it in centrally there. I'm going to try picking it up again and work my way along and then reassess and see how that's feeling. So a little bit of what I would call fascial work without oil on technique. Another kind of component to that is doing what could be perceived as like a fascial pin-in stretch. So I'm going to ask her to try and relax her muscle. Good. I'm going to pin towards the clavicle and the sternum here above my drape line. And then I would slowly bring the head back towards myself, trying to get a little bit of a lengthen. So again, I'm going to pin into the muscle a little bit, and then I'm going to drop the head back. If you have adjustable headpiece or you ask them to bring their head off the table, you can also increase the length by having it drop lower down. So that could be a technique that we try to create a little mobility. And then again, I might try to move the fascia or kind of just superficial tissue around the mastoid process as SCM and splenius capitis are all kind of blending around our mastoid process. Again, I'm going to add a little bit of a lubricant. So I'm just going to go gently down over her effleurage and stroking type motion so I can not have as much friction as I'm going to treat down her sternocleidomastoid. I'm going to bring it a little bit back towards center for myself. So again, just some nice warm-up strokes. I'm using very light pressure. It shouldn't be more than a 1 or a 2 on a scale out of 5. Working my way down along, and now I'm going to try to release it up near its mastoid attachment. So we're doing some fingertip kneading in this area. Right off the mastoid, I'm going to sink in, slow down my stroke a little bit, and try to push down along its fibers. So it's not just mastoid process, but it actually extends back onto the superior nuchal line of the occipital bone. So if she was to lift up her head ever so gently, so this is the mastoid attachment. You can see me going through the fibers, but I'm also going to get in behind and get into these fibers here. You can relax your head back down. So since it blends with splenius capitis, you might have a person that starts to feel a little bit more of a pain or sensation that travels down towards the back, which might mean an indicator that you want to work on splenius as well, which will help SCM out. Okay, we'll loosen up both ends there. I'm going to now work towards the bottom. So I'm going to do some generic strokes across the clavicle and the top of the sternum, the manubrium. Again, making sure that you're not putting a lot of digital pressure down in this location. I'm going to put my pressure in towards the suprasternal area, and I might go down along the clavicle a little bit. In this instance, what I'm going to do is just place my thumb onto the top of the clavicle and try to get you to relax your neck as much as you can for me. Good. You can see the tone of her muscle went down a little bit. I'm just going to bring her head away. So I'm trying to work on that clavicular head. We can do some ipsilateral rotation and a little bit of lateral flexion away as I'm getting a bit of a pin on the top of the clavicle and a stretch. Are you okay with my pressure with that? Mm-hmm. Any numbness or tingling going into your arms and working?
No.
Perfect. There is a very close relationship between the anterior scalene and that clavicular head of SCM. So if I get her to lift her head up for me, so right in here, this is the sternocleidomastoid, but this muscle that I'm going back and forth, as you can see, it's deeper, is going to be her anterior scalene. So I can get her relax. So this would be my finger on the anterior scalene as it's going posterior to the clavicle, versus this belly here, which is attaching into the superior aspect of the clavicle. Okay, we're gonna bring her into a little rotation, and you're gonna see me being able to kind of pick this muscle up a little bit better. I'm gonna try to cross fiber through it. So what I like to do is take my fingertip and my thumb, and I'm just going to slowly pull through the fibers like so, now that I have the lubricant on, and that way I get a little bit of a slide, and I'm going to see if there's any twitch response or kind of jump signs in the muscle belly. And if you do really come across a top band, I'm starting to feel one right in this area here. Let's see, and it's going to let go right there. So if I can hang on to that for a little bit, I might check in on our pain scale and see if we're getting any referral. So to see if it's traveling up, and then you can look into kind of referral patterns from sternocleidomastoid. How are you with the pressure that I'm pushing right now?
It's good. It does refer up a little bit.
Getting a little bit of referral? Mm-hmm. Excellent. So I'm just going to follow through with that and travel up a little bit higher. Okay, and again a little bit higher, and just see different locations and how SCM responds to some digital pressure. So instead of pushing down, which is going to start to compress into nerves and arteries, I typically like to compress between something, kind of do more of a pincher's grasp, so that I'm again avoiding compressing other structures while I work on SCM. I always suggest a very bit of light work medial to sternocleidomastoid if they're comfortable with it. We've talked about it prior to the treatment. I'm just doing a little bit of hyoid work. So if she lifts her neck up a little bit, so again, here is a sternocleidomastoid. When she relaxes her neck back on the table, this is slightly medial to that on the infrahyoids. And we've discussed some treatment of a little bit of anterior scalene, some treating muscles on either side of it, and getting into that splenius capitis a little bit, coming off a similar posterior attachment. So essentially releasing all of its attachments, manubrium, clavicle, mastoid process, superior nuchal line, treating all the way through its belly, making sure it's a little bit more mobile. treating anterior structure as well as posterior structure to it, as well as we did a little bit of a lengthening. And once I have her up off the table, I would go through some sternocleidomastoid stretching, just to make sure that it elongates properly. And after I've done some clearing strokes, as we kind of clear out this area, I'm going to get her just to do some gentle reactivation of it, just to make sure that when she does contract it right now, we don't get any automatic pain in case we have to do a little bit more work in that space. So just a little bit of clearing strokes down the side of the neck. And if you would just gently lift your head up and back down. Is there any pain as you're doing that motion?
No.
No? Perfect. Okay. And again, a last bit of a palpation just to see if there's any noticeable changes to my hands. All right. That is going to conclude our little demo treatment of sternocleidomastoid.